Hi everybody, it's Renee Flynn here and I'm with my oncologist, Dr. Anne-Marie Bedeau, and this is our first episode of SuiteTalk, where we want to open up a conversation with you about everything to do with survivorship, education, living with a new life, a new normal after a diagnosis of cancer, especially women's cancer. So our first guest is the amazing and wonderful Arden Moulton, who is the,
Program coordinator of Woman to Woman and social worker.
so it's big stuff here. We're gonna get lots of information. So tell us a little bit about what your day's like. When you get into the office, you get hit with what? A lineup of cancer patients?
Well, my day is geared around a schedule of what patients are there for treatment and who is newly diagnosed on the floor. Our volunteers who are survivors see women who are newly diagnosed and in treatment for gynecologic cancers.
Oh,
So I look at our census and I talk to our other social worker and we determine which woman would be appropriate for referrals. Then I meet my volunteers. Every day is different.
so for the most part, you work at Mount Sinai.
Outside
And-
medical center.
So when the patients come in, they're newly diagnosed. They've
Yes.
just found out that
Most
they
of the
have
time.
some
Yes.
form of gynecological cancer.
Mm-hmm.
And you're sort of on the forefront there to give them education,
Yes.
because you know, you see it every day, and I certainly know from experience, you sort of get this diagnosis and you're like, okay, now what?
Exactly.
Brochures, booklets, websites, and you have volunteers that actually have gone through it to help the women go through the process.
Exactly. Our wonderful social worker, Brooke Pennypacker, meets women first to see whether they're interested in a referral to woman. We give them a while to recover. It takes a while to
Yeah.
recover. It's usually a rather major surgery. And then she goes in and meets with women and offers the program to them. And then I go to meet them to figure out who would be a good mentor for them. We match women by demographics, diagnosis, and actually I ask women, who would you like to serve as a mentor for you?
Right.
So after about 4 or 5 days, we do that, and then the volunteer comes in. I try to have them meet face to face. It's important to me, and for the patient. And then the survivor volunteer, follows them through
How
treatment.
many women say yes or no? Does everyone say yes?
Almost everybody says
do.
yes. We determine ahead of time. We also have to be sure that the volunteers who are survivors themselves
Right.
are able to interact in an appropriate way with
Are they
the
trained,
patient.
or are they
They're
just-
trained. They're very extensively trained. They're trained. They have a 12-hour training before they're screened first very carefully by their doctor and by me. Then they're trained. We have ongoing training monthly meetings with ongoing training.
Wow.
We have speakers and we talk about last month we talked about resilience, which is a very important issue for women. And I also meet with them individually to be sure they're processing things in a way that is appropriate for them and not
Right.
disturbing for them.
Right,
It's
right.
hard work.
What do you mean by resilience exactly? Like just
Resilience in how you cope. What coping is,
Bouncing
you're
back
in a
from-
crisis. It's a crisis for women.
right.
I can tell you that when patients come here for chemotherapy and they have had an encounter in the hospital with one of you, they're very, they look forward to meeting, to talking with you, going through issues that they have in here. I know that you guys have come down here and sat with patients
Yes, we
on their
have.
first chemotherapy, and that has been very helpful to them also.
So I'll give you guys just a little bit of a background so you know the dynamic that's going on here. I was an ovarian cancer patient, and Dr. Anne-Marie Bedeau is my oncologist. And this is in fact the chemo suite where I received treatment. Arden is one of the first people I had met in the hospital right after I had gotten my diagnosis. So it's a little bit of taking you along this path of what happens to every woman once they get hit with this diagnosis, and really trying to get better educated and more information and a conversation going so that questions that you're too embarrassed or too shy or really don't even know where to go to get an answer, it's important that you meet and know that there are people like Arden, and know that she exists, and this amazing organization, Woman to Woman, so that you can work with volunteers who really have gone through this whole process, have excessive training that you had just talked about, and also can speak to you directly on really intimate matters or questions that you think about in the dead of night when you wake up and you're like, oh no. So these organizations do exist and we need more and more of them. So anyway,
I think what's really important is that all of you volunteers have gone through this, correct?
All of them are
and then
survivors.
go through the
So
extensive training.
it makes such a big difference to the patient, because when they relay to me
Huge.
what the experience has been, they had somebody who actually went through this, who knew, exactly what kind of road mines there were along the way, and it gives them a sense of comfort that they can relate to this person.
Anne-Marie, they're still alive to talk to me. That alone is a
Right.
big deal.
That is a huge,
I'm
huge
talking
piece.
to someone on the other end of the phone who's, got a pulse.
Right, absolutely,
This is a
absolutely.
good thing.
No, that,
I don't think there's anything more important when you're first diagnosed than hope, than knowing that there is hope. And there is hope. And meeting someone who's living their lives and going on, who's experienced the same thing you are, is one of our founding volunteer said, Valerie Goldfein said, I've been where you are. And it's a hugely comforting to know that.
absolutely, absolutely.
And also, they also relate on a way that's totally different than us, we professionals. They will
Right.
tell things, I think I'm just the best professional in the world. They will tell
Yeah.
our volunteers
Exactly.
totally different
Yes.
things
Right.
on a very different level. And it's
Yeah.
very comforting. It was actually started by a survivor and Dr. Bedeau and Dr. Dottino, because women wanted to talk to someone who'd been through it.
Right.
Bottom line, I love my doctor, but I really need to talk to someone who's
Right.
had the
And
experience.
it is quite different, the kinds of things that they ask,
Totally
the volunteers, and they would come to me
Totally
with, or to
different.
Dr.
Exactly.
Tino with, it's totally
Exactly.
different.
And just the time too. I mean, you can't really
Right.
tie up your doctor for an hour saying, really, are you sure? Is it
And listen, there's some
You promise?
questions that it's difficult for the doctor to approach the patient.
Right.
Your focus as a doctor is like, we wanna get you better, we wanna do what we can for
Right.
you. And then you sort of feel you're being distracted by talking about other things. Say for instance, sex and cancer. That's a really big topic that patients don't really come to us with. And I tell you that most doctors unfortunately don't bring it up. And as long as it's not mentioned, you could kind of navigate all
Yeah.
the other problems that, they're big problems, you lose your hair, everything else, you get focused on that. And you don't deal with these really intimate problems
Well,
that patients have.
just talking about general education. And there are brochures in hospitals, sort of generic, and then you have your doctor one-on-one time. But you spoke to earlier, when we were talking separately about, some women don't even expect to lose their hair.
No.
Or don't know about nausea or
true.
side effects, or how it's going to impact family finances if someone has to stay home from work. I mean, there's that whole piece. How do you find the education piece of this whole experience? Do you think it's seriously lacking? I mean, I go on the internet and that's not a good
No,
place to go.
do not go on the internet. A lot of the information is old and inaccurate.
Right,
It's important to have the healthcare professionals provide you with education. Each woman is different. Each woman's gonna get a different protocol.
And they have a
chemotherapy
different
pro-
cancer.
They have a
you know.
different cancer. Each
Yeah.
situation is different. So it's very important that a healthcare professional meet with women after they've been diagnosed and their pathology is back, so they know what stage they are, so that they can figure out what their
is
treatment
there
is.
enough help out there? Is there enough education out
Not
there
in
right now?
not in my opinion. I want it to be individualized. That's the issue. I think
Right.
that you can go
Right.
on a website, but unfortunately it isn't individualized enough.
Of course
And
not.
women see, and there's every single woman we meet is terrified of nausea. And they're looking at an old chemotherapy
Right.
paradigm
Exactly,
that does
exactly.
not understand, you do not have to have this intractable
We've
nausea.
come a long way. We've come a
come
long
a
way
long
with
way.
drugs, with so many
Exactly.
things, and the old vision that people have is a woman sitting over
It's
a
Deborah
basin.
Winger and
Yeah,
Shirley
exactly.
MacLaine.
Right,
It's that
exactly.
one.
You
That movie gets
puking your
yanked
brains
over.
out.
Netflix, it's gotta
Yeah.
go.
That's
Right.
not real anymore. I
And
think
it's
that's
not,
right. I
you know.
see very few
Right.
women that have that
Right.
have serious.
It happens
nausea.
occasionally, but even when it happens, then
It's
you know what to
treatable.
do the next time that you'll
Exactly.
prevent it.
No,
Exactly.
I worked through the entire
Right.
chemo and I wigged it, so
Right.
I didn't
Most
even
women,
tell
a
them.
lot of women want to know what to expect in terms of their lifestyle. How is my life going to change?
Right.
Can I still work? How are my children going to be impacted? That's a huge
Right.
question
So these
for
are the
women.
questions you get.
Yes, and
on
my
a regular-
volunteers get all the time. how is this gonna affect my relationship with my husband? How
How
is this?
does it? What, do
It
you have
affects
any odds on?
it in a very, in general, you can't help but affect it. It's a major change in your life.
I
It's a
wonder if there are
major
any
crisis.
statistics on like divorce rates, or, didn't you say in the chemo suite, this chemo suite, someone was
Someone was served with divorce papers in the chemo suite.
in a
In
freaking
the chemo suite, in one of these chairs.
Jeez.
There was a knock on the door, and the man came in,
Oh,
and
no,
said,
Oh,
Mrs.
no.
So-and-so,
no.
I've served you these papers, and it was devastating. It was a whole story in itself. And,
Talk about mood swings, maybe she was a bit, I don't know.
but that happens,
Geez, that's-
you know, things
that's
happen,
cool.
and
In my experience, I have really only heard a lot of wonderful stories about partners.
Support and,
Partners usually they have to adjust. Their lives change
Yeah.
irreversibly.
But
Everyone's
partners
lives
are-
change.
I think are the neglected entity in this whole
Absolutely.
Right.
process.
And we have a program for partners. I don't
Yeah, tell us
find a
about that.
lot
That's
of
a great
men
program, I think.
accessing it because we actually did a pilot study with about 7 men whose wives had been diagnosed with in particular ovarian cancer, and asked them what they would have liked to have seen in a support program. Every one of them said, absolutely no support group, I don't have time, I don't talk about my feelings, I just don't want to do that. They all asked for information, so we created a guide for men. Women don't understand their bodies, men really don't know what's going on down there. So they needed a guide to help
A
them.
roadmap.
A roadmap. We have pictures.
they should
And-
probably get that at like 15 or something.
Seriously. And then we offer them support through the social worker. No, very few men have taken us up on that. And it's also for all partners. There are issues for every relationship. It's a whole family issue.
Right.
And as I said before, children are a huge concern, especially for, of course, younger women. And it's very reassuring for a woman. We're just dealing with a wonderful woman who's a patient of Dr. Beddoe's, whose absolutely first concern is for her teenage sons. The minute you bring it up, she starts to cry. It happens all the time with women. This is their first concern. How do I deal with this?
Right.
What do I say? What do I tell them?
Well, I guess the first thing that, Dr. Beddoe, I hear you talking about it all the time, is just, you know, it's a disease that you live with, and that it's not the death sentence, and that the family, sometimes, you know, it really gives you an opportunity to prioritize and really, like, no one, certainly the American culture doesn't deal with the life expectancy ending. We know that we're here temporarily, and I don't think that really registers on a day-to-day basis that, you know, embracing life and making choices, knowing that you're here for a short amount of time.
So one of the things that I have noticed is in this chemo suite, we can invite, you know, guests. So you can come with 1 or 2 visitors, and a lot of men don't take advantage of the opportunity. They may come for a, you know, 10, 15 minutes, settle their
Oh,
wife
it's a
in.
hen house
And
in
then,
there.
it is, I know, and a lot goes on, and you don't really want to be the only man, but some men stick it out.
Yeah, no, they do.
And I think those who have stayed, they kind of like it, you know, they like it.
They go out and get bagels and use the bathroom a lot, I noticed.
That's
the men.
true. But a lot of talk goes on, and I think I'm like the fly on the wall. I don't delve too deeply into the conversations. But a lot of talk goes on, and I hear the kinds of issues that women have, but they never present it to us, and that's why I think the women-to-women group is so good.
It's very, very hard to get men to talk about their issues. And I think they feel disloyal. I think they don't even know what their issues are in the beginning.
I
They're
agree.
terrified. And the other piece that's so important to remember is that I think a lot of partners in general feel like they should fix it.
Right.
Yes.
I wanna be
yes,
able to
that's
fix
true.
But people have a
Why
lot of
can't I?
control, and this really makes you lose your
Exactly,
control.
exactly.
You have no control when you're going through this.
And it's terrifying.
Yeah, it
It's
is
terrifying. It gets better as time goes on, because I think you can feel you've made a difference in other ways, and you can control some of it.
Right.
It's just in the beginning, it's really very scary. And men have said to me, partners have said to me, it's not about me, it should be about her. And I always try to say it's about you as a
It's an entity,
partnership.
yes, it is.
Family also.
And it doesn't matter whether you have heterosexual couples
Doesn't matter.
or
Doesn't matter.
it makes no difference.
No.
We have, you know, partners here, women,
Absolutely.
and they it's the same kind
It's
of
the same
issue. You
issue.
face the same issues. It's,
Yep. And I think you do in your relationships in general.
right.
You wanna take care of each other, and when you're faced with this kind of a crisis,